Welcome back to the 4 on 5. Please don't forget, Veterans Day is Monday, and today we're talking about mental health. Dr. Luke Engeriser, Deputy Chief Medical Officer from AltaPointe Health, is joining us. Thank you for being here. And you were a veteran yourself, so you know both sides of it.
Yeah, I do. I was very privileged to be able to start my medical career in the U.S. Army. So I did residency training at Triple Army Medical Center in Hawaii. And then I spent 3 years serving at Fort Benning, Georgia, now Fort Moore, Georgia. And in my last year, I was the chief of behavioral health, so I oversaw all the behavioral health services on post, substance use services, and really could see firsthand some of the challenges that our veterans were facing.
And what are some of the biggest challenges you saw when you were in the military and now you're seeing on the other side of it from veterans going to you for help?
Yeah, well, something that's been really new with some of our more recent veterans is the idea of repeat deployments. So kind of in the old days when there was a war like World War I or World War II, you would deploy and you would be there until it was over. And what's really different with Iraq and Afghanistan is that veterans would deploy for a year, come home for a year or two, and then have to deploy again. And you can just imagine the stress that would place on them and their loved ones back home.
The entire time, absolutely. And you were telling me what some of us may not realize is the suicide rate is a lot higher than we'd like to think.
Yeah, it's really tragic. Over the last 20 years, the suicide rate among veterans has been incredibly high, so 1.5 times the civilian population. And with female veterans, even more striking, 2.5 times that of civilian women. So, and there's a lot of reasons for that. The repeated deployments, the mental health issues, substance use issues can be high. But one of the other things that can happen with veterans when they return to civilian life, that transition can be very difficult. So many really miss the structure of the military, that sense of mission that you have in the military. You can really feel that loss when you get to civilian life. And then finally, sometimes feeling like civilians really can't understand the things that you may have gone through.
Another thing we were talking about, social media. It's much different now that we have social media. Things have changed for all of us, and where a comment from a stranger or something may sting a little bit, in certain cases that could really hurt a veteran and possibly put them over the edge.
Yeah, it really does. And it's something to keep in mind. Our combat veterans have risked their safety, even their life, to protect us and our freedoms, and that requires a very high level of respect from all of us towards them. They might want to talk about their experiences, but more often they don't want to talk about their experiences, and casually and carelessly making comments on social media, that's just not something you should be doing to veterans.
No, absolutely not. And you, of course, only see those who do seek help, but there are so many who don't for a number of reasons, but they can, because AltaPointe is here for them.
Yeah. Anybody that needs help can call our AltaPointe Access to Care line. We have a wide range of inpatient and outpatient mental health services. I work at our Behavioral Health Crisis Center, which is kind of in availability if anybody has a mental health crisis. And even if we don't have the service that somebody needs, if you call our Access to Care line, we will help get you in touch with the services that you need.
Absolutely, point them in the right direction. So if you are a veteran, you are watching and you're there on the line, should I talk to somebody? Please do. And if you know a veteran who you think needs to talk, let them know. AltaPointe is there for them. Thank you for being here.
Thank you so much.